Hey, good afternoon, everybody. Welcome to the SOS special presentation. Today we have Dick Anderson with Shiba, and he's going to have a Q&A session afterwards, so save those questions and we'll get started. Thank you for joining us, Dick. Would you like just to start the presentation?
Thank you very much. Now, we're going to have some information for you to write down, so you might want to get pen and paper handy. We're coming up on the annual enrollment period of time, which is the October 15th to December 7th time when you get to make decisions about what your healthcare is going to look like next year. Now, Shiba is the statewide health insurance benefits advisors program that volunteer counselors who are certified by the insurance commissioner's office. And this was the first of its kind anywhere in the United States. In 1979, 43 years ago, a group of citizens got together in Anacortes, Washington, and asked the insurance commissioner's office to help them understand Medigap policies. Well, we're still doing that all these years later because Medigap policies are still the most frequently, the most favorite kind of supplementing insurance, for the obvious reason that it does a good job of filling the gaps in Medicare. And with most policies, after you've covered your Medicare Part B deductible, which is $233 this year, everything else in Medicare A and B is covered at 100%, and people like that. It gives you some certainty about what your costs are going to be for the year. Now, my wife and I are snowbirds, and we go down to the California desert in the wintertime, and I do the same kind of counseling down in California for the California Department of Aging. Well, this idea got around to so many places where they thought it was a good idea that now there is a SHIP program, that's Senior Health Insurance Program, in every state and territory of the United States, where there are volunteers like me who are providing unbiased, accurate, confidential information about Medicare and all things having to do with Medicare. And it's a great program. Every year we help people, actually thousands of people every year, save thousands of dollars. And it's all free. We don't sell anything. We're not trying to persuade you to do one thing or another. We're trying to give you enough information so you can make your own mind, make your own decision. All right. The thing about looking ahead to next year is that things tend to change. Now, Medigap policies are standardized by an act of Congress, so they don't change every year. So if you're fortunate enough to have a Medigap, you don't need to change your Medigap policy. It's going to be good next year, just like it was this year or last year. But other plans do change. Coverage changes for prescription drug plans and for Medicare Advantage plans, and costs change, and it's possible your needs are going to change for next year as well. So when we look at the four parts of Medicare, the inpatient hospital care, the Part B medical care, which is all the other stuff, the doctors and lab reports and preventive medicine and all of that good stuff, and Part D, prescription drugs, which first became a Medicare project in 2005. That's original Medicare. That's what you get when you enroll in Medicare to begin with. You get Medicare Part A and Medicare Part B, and then later you will enroll in a Medicare Part D plan. However, let me clarify that, because if you have an employer's group medical plan providing you with health insurance after you retire, you will not need to buy a Medicare Part D plan if your employer's plan covers prescription drugs, and most of them do. So that's one thing that, oh, and one other thing. If you have VA medical benefits, that is, if you have VA prescription drug coverage, that is considered to be as good as Medicare's coverage, and you will not need to buy a Part D plan. You will have fulfilled your requirement to have prescription drug coverage. Part C includes all of the Medicare Parts A and B benefits, and Medicare pays them extra money every month to provide prescription drug coverage for most of them. There are some plans that don't include drug coverage, but most of them do provide drug coverage. So it really can be an advantage for you. Now, you get to decide how you want to get your Medicare. I mean, that's the American way, right? I mean, we have Fords and Chevrolets and Toyotas and my granddaughter's favorite car, a Subaru, which she calls her Cascade Cadillac because it has a four-wheel drive. And it's nice for her to come over and visit us with her being sure that she's not going to get stuck somewhere along the way. So you see Medicare the original part of Medicare A, B, and Part D. And that's the original Medicare that you can choose. And most people, no, I can't say most people, that is still the most popular way for people to get their Medicare and to have their Medicare supplemented. These Medicare supplement insurance plans have been great. They let you go to any doctor, anywhere, anytime. You don't need to have a list of doctors that you're limited to. You can go to any doctor, and you don't need to get permission. You don't need a referral. A Medigap policy is good anywhere in the United States, its territories and possessions. Now, that comes to Medicare Part C, which is the Medicare Advantage plans, which have gained in popularity, especially in the metropolitan areas. Now, when you think about North Central Washington, you probably recognize that this is a rural part of the state, and that 2/3 of the people who live in the state live over on the wet side, right? And so Medicare Advantage plans are a lot more popular over there because Medicare pays them a big bucket of money the first of every month. It's called a capitation rate. It's a per head rate. Every head who's enrolled in a Medicare Advantage plan, Medicare pays to have that person receive care through their Advantage plan. It's a very significant, it's actually about 15% more than what original Medicare costs. And so the Plan Cs really do try to offer things that Medicare doesn't cover, like dental or routine eye care or hearing aids. Now, Medicare doesn't cover long-term care, so you know that's not going to be a part of any of the Medicare plans. And so when you use a Medicare Advantage plan in this part of the country, you will also probably have a co-payment. And those co-payments can really add up. And so you want to be very careful that you understand what you obligate you for when you get a Medicare Advantage plan. Most of them, like HMOs, have a list of providers that you're required to use. You agree to use their list of providers when you enroll in the plan, because those people are getting paid by that money that Medicare pays them every month. There are PPOs, preferred provider organizations, but not in every county. They provide you a benefit like an HMO does, but they also provide you a benefit when you go to a provider outside of the plan. And that's one of the features, one of the benefits of having a PPO, but they are not available in every county. And so if you have an Advantage plan, it is against the law for you to be sold a Medigap policy. And if you have a Medigap policy, you do not need an Advantage plan. One of the things I like to advise clients is if you are attracted to an Advantage plan because they're offering dental products or dental care, ask them before you enroll how much a dental benefit you're going to get. Because people have received phone calls telling about all these fabulous benefits they're going to get if they enroll in one of these plans, only to find out that dental benefit may be about a $200 or $250 allowance once a year or for the total year. And it should come as no surprise to you that the amount of dental care you can get for $250 is pretty limited. Okay, how do you figure out what plan is the right plan for you? Well, I encourage you to talk to a Medicare, a Shiba counselor. They are in every county of the state. There's a wonderful Shiba counselor in Methau. We have counselors all over North Central Washington. And, you know, everything we do is free. We don't sell anything. And all we want to do is provide you with the information you need to make an informed decision about your plan should be. But you can go online yourself and go to Medicare.gov. That's Medicare's official website. And you see now the picture may be different. They change this picture a couple times a year, and it drives me crazy if you're trying to put it into a presentation. In Medicare.gov, there is a plan finder, and you can click on that and you can look and compare prescription drug plans and Medicare Advantage plans. And you want to look at make sure that the drug plan has all of your medications, make sure the Advantage plan has your doctor in it. And one of the things you'll want to look at is the pharmacies. Now, this is not a very well-known fact, but it should be. And that is there are three kinds of pharmacies in Medicare Part D, the drug coverage for Medicare. There is the out-of-network pharmacy. There is the standard cost-sharing pharmacy, and there is the preferred cost-sharing pharmacy. With an out-of-network pharmacy, you are going to pay the full retail price of your medications. Now, I use myself as an example for this because I take just 4 generic maintenance drugs. That's what I take every day, is 4 generic maintenance drugs. And if I went to an out-of-network pharmacy, I would have to pay full retail price. And this year, when I compared the plans, it would have been a little over $3,200. That's a lot of money to pay for generic drugs. At a standard cost sharing pharmacy, you would get some benefit. It would have cost me at a standard cost sharing pharmacy for my 4 medications between $1,400 and $1,800, depending upon the pharmacy that I used. But by going to a preferred cost sharing pharmacy, and they are all around the place, so they're not that difficult to find, but you need to know about them. In this calendar year, January 1st of this year to December 31st, the copays for my 4 generic drugs is a little under $150 for the entire year. And that is why it is so important for you to know about these different pharmacies and the costs, what you can save. Now, I told you I do counseling down in California, and this year in March, before we came back, one of my longtime clients called me on the phone and said, "Dick, I think I'm paying too much for my prescriptions." I said, "Well, send me your list and let me do a comparison for you." She did, and I did. And I called her back and I said, "You know, if you would have come and talked to me last October, we could have saved you a lot of money. But while you can't change plans in the middle of the year, you can change pharmacies. And if you will go to the pharmacy just across the street from the one you're using now, you can save $874 between the 1st of April and the end of December. And that's a lot of money for somebody who's on Social Security. So you can use the Plan Finder for finding out that kind of information. Now, here's some helpful information. You might want to write this down. This number, 1-800-562-6900, is the hotline at the Insurance Commissioner's office in Olympia. You can call there and ask any question you want about insurance or make a complaint if you have a complaint, or you can call there to find out where you can reach or how you can reach a Shiba volunteer, either in your part of the state or in another part of the state. And they'll be happy to help you with answering questions or getting you in touch with a Shiba volunteer. It usually takes about 2 days by the time they get the email sent to the volunteer in your neighborhood or in your town and the time they can call you back. But if you have any questions about insurance, this is the insurance commissioner's hotline. Now, I used to tell people that was his personal phone number, but I don't do that anymore. They got a little itchy about that. And of course, you can, if you don't mind hanging on for a long time, you can always call 1-800-Medicare. All right. Now, there are programs available to help people cover Medicare costs, especially low income or lower income people. And this is, again, something that a Shiba volunteer can help you with. This is my best year ever. Before the pandemic, the most people I'd ever been able to do an application for extra help or a Medicare savings plan, the most I'd ever been able to do in a year was 35. And I was so happy. It makes me so happy to be able to do something that for somebody who has a limited income. And this year already, I've done 44 applications for extra help with prescription drugs and 42 for Medicare savings plans. So this is a banner year for me, I can tell you that. I love doing the work and I love helping people get help with their Medicare costs. Now, here are the numbers, and I want to mention something that recently there was a law passed in Congress, and that these numbers are going to be subject to change next year. And so you might want to write them down for now because they're good for the rest of the year, but hopefully there will be some significant changes for next year. I don't know. I've heard that there are going to be some seminars, and I plan to tune into some seminars and get fully informed, but I probably won't be able to have accurate knowledge until about February is my guess, February or March, or maybe even April, because I think it's a moving target right now. I think they're working on it. But a Medicare beneficiary with a monthly income of under $1,200, $1,153, there's a $20 allowance that can come off of that. But when they talk about assets, they're talking about exempt assets. Your car, your home, your personal possessions, those are all exempt. Those are not counted. This is like money in the bank or savings accounts or that kind of thing. So if you have a friend or if you know somebody that falls into this kind of income level, tell them to talk to a Shiba volunteer. Here's for extra help with prescription drugs. And this can make a wonderful difference for people with expensive medications. And you can see, this is a federal program, this Social Security program. You can see that the income levels are higher and the asset levels are higher. And so if they have a question, if they're even close to that, call a Shiba volunteer. We might be able to do them some good, and we would love to do it. Absolutely love to do it. Now, if you think that you need some additional help with Medicare, I'll tell you, there are about 250 certified volunteers ready to go to work right now. So please call and let us do some good. Here's some local numbers. This is Action Health Partners in East Wenatchee. Eureka Robles is our volunteer coordinator. She's been doing it for more than 10 years and does a wonderful job. And Aging and Adult Care of Central Washington has been a great partner for 13 years, long time. You see, I got carried away with this. Okay. Can I answer any questions for somebody?
I have one, Dick. What happens if somebody forgets or maybe procrastinates too long and they don't sign up in time when they become of age for Medicare?
Okay. If they are covered, if they're working for an employer and covered by the employer's group medical plan, there's no penalty if they wait until they're no longer employed or no longer covered as a spouse of an employed worker, for instance. They get a special enrollment when they are no longer employed or no longer covered by an employer's group medical plan, and they have 8 months, a special enrollment period of 8 months. But even maybe more important than that, they have a 6-month special enrollment period to enroll in a Medigap policy if they want one. That's a guaranteed issue period of time. They can't be turned down. There's no late enrollment penalty. It's great. Now, if they just didn't enroll, there's a couple of things. Every full 12-month period they don't enroll in Medicare that they should have, there can be a late enrollment penalty for the Medicare Part B premium. But here's something a lot of people don't think about. If that individual didn't enroll in Medicare Part B because they couldn't afford the premium, they may be eligible for one of those Medicare savings plans. And if they're eligible for one of those Medicare savings plans, which pays their Medicare Part B premium, Washington State has a buy-in desk where they can enroll in Medicare Part B if they're eligible for one of those Medicare savings plan. We call it a conditional enrollment. That is, it's conditioned on them qualifying for one of the Medicare savings plans, and then Medicare will automatically, not Medicare, DSHS, the Medicare savings plan, will automatically pay their Part B premium, and the penalty will go away.
Nice. Okay.
I have a question. So how does somebody enroll in Medicare, and what information do they need to have gathered together in order to enroll?
Okay, there's a couple of answers. You can go online to medicare.gov and you can enroll in Medicare on medicare.gov if you're coming up to your 65th birthday, for instance. That is probably one of the easiest ways to do it, but even easier than that, if you're handy with your computer, is go to ssa.gov, Social Security Administration, and there's a place where you can enroll directly into Medicare. You can set up your own personal Social Security account online, and you can do it through that online portal as well as doing it on Medicare. Does that answer the question?
Yes. What information will they want in order to enroll? Do you need to have financial information or anything like that?
Well, Social Security already has your financial information. No, they don't need that. They need your Social Security number. They need your name as it appears either on your Social Security card or your Medicare card. If you're doing it online, you'll have to have a valid email address. Now, you can do the same thing by calling Social Security on the phone or going to the Social Security office in Wenatchee. They take walk-in customers now, which they didn't for a couple of years. And you can walk in and apply for Medicare and get that job done. Now, if you're still working after age 65 and covered by an employer's group medical plan, either as an active employee yourself or as the spouse of an active employee, then you will need to have a letter from the employer showing that you had that employment-related medical coverage after age 65. And then that's the kind of thing that you can't really send through the mail. And well, you can send it through the mail. But you want to talk to Social Security on the phone and find out how they want you to get that to them in a format that they will accept. They want you to send it to them in an email, but because they don't consider that to be confidential or secure enough. And my advice always is, if you can, call the local Social Security office, make an appointment, take your letter, if that's what you've got in there, take your social number, your Social Security card with you, and you'll need your date of birth and that sort of thing. And they'll be happy to get you enrolled.
Okay. Do you know what the income limits are for people that continue to work after applying for Medicare?
I'm sorry, I missed part of that.
Do you know what the income limits are per year before you're penalized if you retire and then continue working?
There are no income limits. Not that I'm aware of, no.
But don't
If-
they deduct from your Social Security check if you
Oh,
make over a
if
certain
you're-
amount?
If you're drawing your Social Security retirement benefit
Mhm.
before your full retirement age, then there is a deduction for some earnings. I think, I'm not a real expert on Social Security. I spend a lot more time on Medicare, but I think you can earn something like $14,000 before your full retirement age and not have anything deducted from your Social Security benefit. I'll tell you, if you go to ssa.gov, you can ask that question, they'll tell you.
Okay, thank you.
After your full retirement age, you can earn any amount of money and there will be no deduction from your Social Security benefit, your retirement benefit. But there could be, if you're earning over $171,000 a year, it might make your Medicare Part B premium a little more expensive, and maybe your Part D plan. I don't get many clients who are earning that kind of money, I'm sorry to say, but and I certainly don't. Oh, I don't keep track of those levels too closely.
Did anybody else have any questions that they want to ask about? We've got a quiet group today. All right, then.
Now, I think that if you, Lisa, is a part of Aging and Adult Care, and if you have any questions that you think of later, I'm sure she would be glad to pass those questions on. I do counseling in the Aging and Adult Care office in East Wenatchee, and we're pretty good friends down there. I am a volunteer for Aging and Adult Care as well as for Shiba. So I'm sure that Lisa would be happy to pass those on.
Absolutely. Yep. Yeah, I'll put my email address in the chat section so anybody can send me an email or give me a call and we'll get those questions to Dick and get your answers back.
I always, I've given some pre-retirement presentations over the years, and when I talk to people who are retiring, and when I get clients in the office and we're talking, and what are you going to do after you retire? I always say one of the things you ought to think about when you're thinking about retiring is something that is important to you, and then volunteer to make that happen. And healthcare was something very important to me. And that's why I volunteered to be a Shiba counselor. So think about something that's really important to you and then be a volunteer to make good things happen. There's only so much golf you can play, and but only so much daytime TV you can handle. So think about something that is really worthwhile.
I like that. I think that's a great way to end off if nobody has any more questions. Looks like we're pretty quiet over here. Thank you so much, Dick, for taking the time to chat with us today.
You're welcome.
It's really helpful and informative. And if anybody reaches out with questions or stuff, I'll definitely be in touch and we'll get those answered for everybody.
Thank you very much.
Yeah, thank you. All right,
Okay.
everybody, have a great day and enjoy your Tuesday.